And we should be live. Hello, everyone, and welcome back to another session with Dental Shadowers. Today, we have a very exciting session with Dr. Amanda. Dr. Amanda, thank you so much for joining. And on that note, the floor is yours to take away.
Awesome. Thank you so much. And thank you, Dental Shadowers, for having me. I'm really excited to present to all of you tonight. I know it's late for some of you on the East Coast, so thank you for being here. And I really hope that everyone learned something tonight, and I'm happy to answer any questions during the session or even afterwards if you want to reach out to me. So let's get started here. Let me turn this off here. Okay. So my name is Amanda, or Dr. Amanda as my patients call me, and I'm actually a pediatric dentist in the Bay Area in California. So first I'll kind of start about my journey to becoming a pediatric dentist. Just a little background, my dad is actually a cardiologist, my mom is a nurse, so I've kind of always grown up around the medical field, and I've always enjoyed science as well. So that was kind of my natural first start into dentistry. And I also have always had a passion for working with children. I would volunteer at summer camps and things like that. So that was sort of a natural progression to wanting to be a pediatric dentist as well. My best friend's dad is a dentist too. And so growing up together, we always joked about becoming dentists. And she didn't, but I ended up going on to be a dentist. And so it's kind of funny how that worked out. But when I was 14 years old, as a lot of kids do these days, I finished my braces. I had spent a lot of time in the dental office. So that's when I really got interested in dentistry and possibly becoming actually an orthodontist at first. So at my high school, we actually have to do a senior project. And so I chose to shadow my dentist. And so I got to kind of see what a dentist does every day. And he also introduced me to Give Kids a Smile, which I'll talk a little bit about. And I also got to teach first graders about oral health, which was a lot of fun working with that age group. So that was kind of my first hands-on experience with dentistry. And as I mentioned, Give Kids a Smile, some of you may be familiar, but it's a program that was launched nationally in 2003 to provide underserved children with free oral health care. And so far, they've served over 6 million underserved children. And so I think it's such a great program. I've participated in it since high school and still to this day. And typically it's in February, which is National Children's Oral Health Month. So that can be something that you can look into if you are interested in dentistry as well.
I'm sorry to interrupt. I think your camera turned off by accident.
Oh, okay. Sorry.
No, you're good.
Is it back now?
That's perfect. Thank you.
Okay. Thank you. Okay. And during dental school, there's a lot of activities I enjoy participating in as well. So I'll go over a few of them. One of them that we have in California, which I'm sure other states have as well, is called CDA Cares. And it's hosted by the California Dental Association. And it's a program that allows volunteers to give dental services at no cost to patients, both adult and pediatric. And they usually see over 2,000 people every weekend that it's hosted. So I started volunteering in dental school, where you're just kind of gathering instruments and helping do intake forms and directing people. And then after dental school, I went back as a dentist, and I went to the pediatrics area was where I enjoyed working. So that's been really fun. Also, something that you guys might be interested as pre-dental students is what's called Pacific Pride Day. So I'll talk a little bit more about my education coming up, but at Dagoni, they actually have an annual open house for prospective students. I'm not sure with COVID how that's going to work, but they may be doing it again this year. And it's an opportunity. You get to go and tour the dental school, meet the faculty, staff, and students. And we also show you the simulation lab, which is where you learn how to prep teeth and fix cavities. But you also get hands-on experience doing impressions and things like that. So it really gives you a hands-on taste of dentistry. So I always loved volunteering with that. And we also had club scope. I don't know if pre-dental students still have that, but it's called Student Community Outreach for Public Education, or SCOPE for short. And so that's where we would go out to oral health fairs, or even just general medical fairs, and then also to classrooms to teach about oral hygiene. So that was something also I enjoyed doing. So that was kind of my experience in dental school. And then a lot of dental schools help arrange dental mission trips as well. So I was fortunate enough to go on, actually on 2 dental mission trips. So these are some photos from when we went to Jamaica. I think this was my 2nd year of dental school. And you can see the lines were huge, and it was just so humbling to see people come from so far. We split into 3 teams to go to 3 different villages to provide oral services. For about a week we were there, and it was sad we could only help like one area of each person's mouth, but sometimes they were able to get in maybe a second time towards the end of the week. But that was just a really great experience, getting to see a lot of patients. And also one of the faculty that was on the trip was a pediatric dentist, so I got to work closely with him and kind of see how he works with patients, which was really fun for me. And then let me see my next one here. I have some photos from when I went to Fiji, and the Fiji dental mission trip actually had a specific pediatrics day. So that was such a fun day for me, getting to work with children of all ages, really young children, as well as adolescents. And so I got a lot of hands-on experience. In dental school, you see maybe 1 or 2 patients a day. But on this dental mission trip, we kind of got to work on our speed and then also our technique, and we were working much more closely with the faculty as well. Also, at Dagoni Dental School, we did something called a personalized instruction program. And it was optional when I was in dental school. It was sort of a new thing that they were trying out. But I chose to do kind of 2 different projects. So one of them was part of going on these dental mission trips. I did a survey of a lot of the patients there. So we would have the dental students help the patients fill these forms out, because I wanted to figure out if there was a correlation between sugar in the diet and their dental caries. And there was definitely a strong correlation that we found. And then when I graduated, I passed the project on to a student after me, to kind of continue the research, because I didn't want the dental mission trips, even though we went every year, to just kind of pop in, fix some cavities for a week and then leave. I'm really passionate about preventive oral care. So trying to figure out the root cause and learning how we can teach these local communities how to improve their oral health. So that was kind of the first step. And then my second project I did was developing an oral health program for elementary school level children. And I worked with another student, and she kind of developed the oral health program for adolescent children. So together we kind of created these guidelines and ideas for dental students to go out to these oral health fairs and even on the mission trips to kind of lead these programs and educate people about oral hygiene. So that's where I definitely sort of developed my passion with pediatrics through that. And then I reached out the director of pediatric dentistry at Dagoni. He is really good about mentoring students who are interested in going into pediatrics. And so he really sits down with every student, kind of goes over which programs you might be interested in. And he also helps arrange what's called an externship. So I believe mine was during summer break. And so I went down to USC, and they kind of have what's considered a hybrid program. So it's a part university, part hospital-based program. Some programs are just purely in the hospital as well. So I kind of got a little taste of both. I got to go into the operating room. I got to see sedations. I got to see how their clinic ran. I got to see how they learned in residency. And I also got to do things like meet their craniofacial team at the hospital. And I went with one of my dental school classmates. He's actually now a pediatric dentist over in Reno. So it was a good way to kind of see and make sure that pediatrics was something I wanted to do. And it definitely just solidified my decision that I wanted to apply. And one thing I will say about interviewing for residency is just to keep an open mind. I thought I wanted a hybrid program, but when I started doing interviewing, I actually realized I was definitely more fond of a hospital program. It was much more hands-on, which was what I was used to at Degoni. So I was really excited about interviewing at some hospital programs. So let's kind of go over my education now. Okay, so as I mentioned, I've kind of known I've wanted to be a dentist since I was 14 years old. So I had a lot of time to research my path to becoming a dentist. And both my dentist and my orthodontist actually went to Degoni School of Dentistry. So that's how I learned about the program. And I'm sure some of you are familiar already, but UOP has an accelerated program. So I applied to be in the 3+3 program. Both of my mentors actually recommended, take that third year, take some time, take some extra classes, do some extracurriculars, because dental school is very busy and you want to make sure you get all the experiences that you want out of college, taking all the classes that you're interested in before you jump into those heavy science-based classes. So I took their recommendation, and I'm sure many of you did if you're pre-dental. I went into college with a lot of AP courses. So I went in and I didn't have to take a lot of those general education courses. So I was actually able to sneak in a semester of studying abroad in Perugia, Italy at the end of college, which was a wonderful experience and a great way to kind of see how other cultures kind of handled not only their dentistry and their oral health, but also their education. So I was really glad I kind of got that last break before I started dental school. So I did my 3 years of dental school training at Degoni School of Dentistry, which is in San Francisco. And there were a few reasons I chose it besides that it was part of the 3+3 program. One is in California, so that's near where my family is, which was really important to me to stay in California. And I knew I would end up here one day, so it made sense for me to kind of stay here for dental school as well. And I also loved that Degoni had a humanistic model for how they teach. When I meet other dentists, sometimes I hear about their experience and it's very different. I'm sure it's changed a lot since I was in dental school even, but at Degoni, they treat you like humans the moment you set foot in the door. And I still keep in touch with so many of the faculty and students and staff that I've met there. So it's just a really family vibe at the dental school. I also really enjoyed at Degoni that it was, you had a hands-on experience. I'm a very hands-on learner. So from day one, you're in the simulation lab. And then by your second year, you're already seeing patients. And the way they kind of structure it at Degoni is it's kind of like year-round schooling. So we did have breaks usually after each quarter and then a longer break for the summer and winter break. So talking to some of my friends who went to other dental schools, it sounded like we had similar breaks, but maybe they were just spaced out a little bit differently. And then after I finished my 3 years of dental school, I did go to Cincinnati Children's Hospital Medical Center to do my 2-year pediatric residency. And like I said, I kept an open mind when I did my interviews, and I actually fell in love with this program. It was very similar to Degoni with how they had a humanistic approach to teaching. And when I was there, Dr. Stephen Wilson and Dr. Sarat Thakurshi were the program director and chief of dentistry. And it was so wonderful to learn from them. Dr. Wilson helped write the guidelines on sedation for dentistry. And so it was wonderful to get that hands-on experience with him. And it was actually, Cincinnati Children's is one of the top children's hospitals in America. So we got to see a lot of unique special healthcare needs cases, not only in America, but from other countries, they would come to our hospital as well. So I just wanted to go into residency and make sure I saw as much as I could, so that by the time I graduated, I would be able to handle and provide really excellent care for any patient that walked into our office. So let's jump into what is pediatric dentistry. So pediatric dentistry is an age-defined specialty, and we provide both primary and comprehensive preventive and therapeutic oral care. So this is for infants and children and all the way through adolescence or until we can no longer meet their needs. So sometimes they have adult tooth needs that we can no longer care for, such as root canals or wisdom teeth and things like that, that we'll have to refer out for. And then, as I kind of mentioned, we do a 2-year specialty residency to become pediatric dentists, and we receive our certificate in pediatric dentistry. And so, this residency focuses on child development, special healthcare needs, behavior management, and then there's kind of 3 levels of sedation. So, oral sedation, IV sedation, and general anesthesia, which is when the patient is completely put to sleep. And we also get to do a little bit of interventional orthodontics. So I did kind of get a little bit of ortho training in there as well. Okay, so I'll just kind of give you guys a few little tidbits that I received some great advice when I was going through my journey. And so hopefully each of you can take away a little something from this. But obviously, GPA and DAT scores are important. If you haven't taken it already, I'm sure you guys know about like the Kaplan Prep and Cracked App Pat for the perceptual ability test. I believe those are both still around. So those are both really great for helping with studying. So, I mean, I'm sure if you're pre-dental, a lot of you probably already have great study habits, but definitely you do want to develop that because you will be spending a lot of time, not just studying, but also developing your hand skills and spending time in the simulation lab as well. So it is really important in college to make sure that you kind of have your routine down. So you kind of know what you have to get done before each test because there can be several tests just in 1 week. It is a heavy course load. So definitely work on that while you guys are in college. Also take time to volunteer and participate in extracurricular activities. I think this is so important because it really helps develop you not just as a dentist, but also as a person, and you can kind of see what your niche is going to be. Are you going to be a specialist? Are you going to be a professor at a dental school? Are you going to help develop some great invention for dentistry? There's lots of avenues you can go in dentistry. So spending that time doing other activities outside of your classes can really help you hone in on that as well. And college is definitely the time that you want to explore all of those options. Just like you guys are doing right now, try to shadow different specialties and then also shadow different practices. At least in pediatrics, I know there's a big variety of how practices can be run. So there's the smaller boutique practices that see maybe like 20, 30 patients a day, just have one dentist. And then there's kind of the medium level where you may have 1 or 2 doctors and you see a lot more patients in a day. The practice that I'm an associate at, we actually have 3 locations and about 5 doctors that rotate through to keep their practice open about 5 to 6 days a week. And we do have an orthodontist come in as well. So I would say that's like a medium level practice. And then there's also the bigger practices, sort of the corporate ones that have multiple locations. They have big management that helps kind of manage all of those different things. And there's lots of different ways that a practice can run. So definitely explore that, see which one you're kind of interested in. And then as I kind of touched on earlier, you do want to expand your horizons when you're in college. Take that time, go study abroad, go travel, read the books that you want to read, play the sports, go see the documentaries that you want to watch. Take that time in college to do that. As I mentioned, dental school is very busy, so you won't have as much time to do that. So definitely expand your horizons. And then I saved my biggest piece of advice for last, but self-care. And I do really want to touch on this because of, it's stressful to go through dental school. And I'm sure even now you probably experience stress being a pre-dental student, having to take a lot of science courses. So you want to make sure, these are your basics: drink water, eat healthy, exercise. And I do recommend for a lot of people if you can get into yoga, because as dentists, we do develop a lot of head and neck tension. So in order to have a long career, it's really important that you do take good care of yourself. And in the past year, it has become more difficult having to wear the N95s and all of the extra equipment. So it was definitely an adjustment. So do make sure that you guys are sleeping and taking good care of yourselves, even while you're doing your studying and all of your other things that you're trying to do. So just remember to take care of yourself, because sometimes in dental school, we did have some students that it's really hard. And so if you can establish those good habits now, it will really pay off when you're in dental school. Okay, so just some quick disclosures. I don't have any financial disclosures. In each of the cases I'll be going over, the consent has been given by the patient and the patient's parent or guardian to use their photos and their information for this presentation. So just please don't have any duplication made of this presentation. Okay, so let's jump into what a typical day looks like for me in pediatric dentistry. So I was covering a maternity leave of one of the other doctors. So I was working about 5 to 6 days a week, but my normal schedule, I usually work about 4 days a week, and then I'll work as one Saturday a month as well. And because we have about 4 to 5 doctors at any time, we do rotate our call monthly. So this is to cover patients that have trauma or pain after hours or on the weekends, that they can call in and reach one of the doctors directly. So we take usually a month at a time. And the reason we do it monthly is because you don't even get calls every single day for our practices. And it's pretty rare that we have to go in for an emergency, but it does happen. So we do make ourselves available. And this is something you get training on in your residency program and then also in dental school. I do a general anesthesia day once a month. So this is where my patients are completely asleep by a medical or dental anesthesiologist. And I just fix all of their cavities at one time. So typically we schedule about 2 hours for each of those patients. And we'll see about 4 to 5 cases depending. And then every day before we get started, we have a huddle in the morning to kind of go over what our day looks like, anything we need to watch out for, if there were any added emergencies, any medical alerts and things like that. And then usually we'll review our patients at least the day before, sometimes a few days before. So I'll just kind of run through, I made kind of a sample of what my schedule looks like for the day. So you can see in this first column here, these would be my treatment patients. So we do schedule them for about an hour. And the reason is it doesn't necessarily take the full hour to do the treatment, but if they do need breaks and things like that, sometimes it can. So we want to leave enough time. And then also we're seeing these other patients at the same time. So that hour gives us enough time to see all these patients. We have had to reduce our schedule in California a little bit to accommodate the precautions for COVID. So extra social distancing, staggering our patients so there's not anyone in the waiting room anymore. So we have had to make a few accommodations there as well. And then in addition to our treatment column, we have anywhere, depending on which office I'm at, one of them's a little bit smaller. So we may have 2 columns of hygiene up to maybe 4 columns of hygiene. And so a recall visit is just a continuing care, or they come in about every 6 months just for the routine exam and cleaning visit. There's also what we consider an office visit, and that's when they come in where they have a question outside of the regular cleaning visit. So it could be a concern about pain, a concern about a wiggly tooth. I'll kind of go over that later as well, what we could cover there. I am going to talk about SDF, or silver diamine fluoride. So we would schedule that over here in a 30-minute time slot. And then we do schedule about an hour for our new patient visits, because we do go over a lot of questions that parents have, and we want to make sure that we really educate the parent. That's a lot about what our first visits are, because a lot of times it's their first child. And so we want to make sure they have all the tools to set their child up for good oral health from the very beginning. And then our follow-up visit, that would just be if they had trauma and we want to see them back every few weeks just to kind of monitor things. Or also maybe we place a space maintainer or something, we want to check on it. So that's what our follow-up visit would be for. Okay, hopefully this video will work. But this is just a little office tour of one of our 3 locations. So this is our front desk area, and then we do have the little door for kids to walk from the waiting room. They love the little door. And then we do have a consult room. We have, like I mentioned, 3 quiet rooms for treatment and general anesthesia. And then we do have this open bay area, and that's where we do our cleaning visits. So those 30-minute appointments. And as I mentioned, we are doing reduced capacity in the open bay because of COVID. So we're usually only seeing families out there at a time. And we're utilizing our quiet rooms a lot more because, as I mentioned, we usually only have 1 treatment patient at a time. So we do have available 2 other quiet rooms. So we've been putting more of our hygiene patients in there just to protect them from COVID as well. Okay, so what chief complaints do patients come in with? So we can see a few different things. Oral pain is probably one of the biggest ones, and this can be from multiple things. It can be from cavities, which can also lead to infection and swelling. It could be from erupting teeth, teething pain, or canker sores, trauma. There can be lots of different things that can cause oral pain. So we'll bring them in so we can kind of figure out what's going on for them. Another reason they may come in is because they have ectopic teeth, or what we call shark teeth syndrome. So you can see in this photo, this is when you have the baby teeth present, and then the grown-up teeth are also behind those baby teeth. This usually happens when patients' mouths are really crowded and they don't have enough room for all of their teeth. So this is definitely something that parents get concerned about if they see. And then dental trauma, there can be lots of different ones that they come in for. So an avulsion is when the tooth is completely knocked out of the socket from trauma. A subluxation, where the tooth is bumped, but it's not really moved, or a luxation, which is where the tooth is completely displaced. One of the best guides out there is dentaltraumaguide.org. So if you guys are interested in learning more about how to handle dental trauma, that's a really great website that we like to use. And so lots of procedures that pediatric dentists can do. One of them is considered under the preventive category. So that'll be cleaning, sealants, and oral hygiene instruction. Sealants are just little protective coats that go usually on the permanent molars. Restorative treatment is when we're fixing cavities, so doing fillings or crowns, either stainless steel or white crowns, or doing a buildup if your tooth is broken. Orthodontic treatment, so this is a photo of an example of a space maintainer, which is a passive appliance. Oral surgery, taking out teeth, removing pathology, or loosening a lip tie as well. And then, as I mentioned, there are sedations that pediatric dentists can perform as well. So lots of different diagnostic tests we have at our use. And so the main one is the comprehensive examination, which is when they come in for their cleaning visits or new patient visits, and we'll take a look at all of these different areas for them. We also will go over the patient history, kind of their background, have they been to a dentist before, how do they do at the pediatrician's office. We do take digital radiographs or x-rays, photographs. We can also do nerve testing as needed to see if the nerve is still alive in a tooth. We'll take study casts and models in case we have to make space maintainers. And then this form is an example of what we call a caries risk assessment. So this will assess diet, fluoride exposure, a microflora analysis, and it just kind of considers how all these factors interact with social, cultural, and behavioral factors to determine how likely a child is to get cavities. And it also helps us determine how often we should be seeing them and what sort of treatment we can do for them. So lots of great new technology we have in pediatric dentistry. One of my favorites you can see here in the photo is the dry shield, and it acts not only as a high suction evacuator and saliva ejector, but also a bite block to help keep the mouth open, a tongue shield to keep the tongue away from the tooth that we're working on, and it protects the oral pathway so nothing's going to go down the child's throat. Silver diamine fluoride, this was kind of newly approved when I was graduating from residency, but I use it almost every day now. So it's a 38% concentration, and it's a topical antibacterial and remineralizing liquid that's used to arrest or stop cavitated lesions in primary teeth. And it doesn't eliminate the need to do restorative treatment, so like fillings or crowns, but it will kind of buy us time, especially for younger children or for the ones who may not be able to sit through treatment yet. And originally it was actually used for tooth sensitivity. Zirconia crowns, these are the white crowns, and they're much more aesthetic, but they may not be as durable as the stainless steel crowns to bruxism or teeth grinding. And it is less conservative of a preparation, meaning we have to take away more tooth structure to get these white crowns to fit. In our practice, we always do white crowns, at least on the front teeth though, for the patients. The Hall crown technique definitely has become more popular, especially during COVID, because it can be done without producing any aerosols. And so this is where we place little rubber bands in between the teeth next to the tooth that has the cavity. And by placing these little separators, it creates enough space that we can just seat a crown over the baby tooth with the cavity, and it will seal out any bacteria or food from getting into that tooth. And we don't have to give any numbing medicine or remove the cavity at all. And it has a pretty close success rate as the traditional stainless steel crowns, where you have to prepare the tooth and remove the cavity. So this is a great option for our younger patients who may not be able to sit through the local anesthetic process. And this one's really exciting. It's finally becoming more popular in America, hydroxyapatite. So it's actually a form of calcium that already makes up 97% of your tooth enamel, as well as 70% of the dentin in your teeth. And so this high amount of hydroxyapatite in your enamel is what makes your tooth really strong from cavities. And the nice thing is it's biocompatible, and it will remineralize your enamel without any known side effects. And there's recently a study actually in 2019 comparing fluoride and hydroxyapatite in toothpaste to remineralize and stop cavities in children. And it was found to be equivalent to fluoride, which is really exciting. So bite tablets is one option, but there's also Risewell and Boca. So now it is becoming more available in America as well. So if some of you have seen my Instagram, a big focus for me in how I practice dentistry is sustainability. And so green dentistry is an approach to dentistry where we try to reduce the dental practice's environmental impact. So for example, 1 billion toothbrushes are thrown away each year in the US. So for example, just by switching to a bamboo toothbrush, you can actually prevent a lot of plastic waste from going to the landfill. So there's lots of things we've been doing at our practice to make it more sustainable. And I'm actually working with another pediatric dentist. You guys can keep an eye out. We are starting a sustainable dentistry Facebook group for dental students and dentists to kind of join, so we can share ways to bring sustainability to dentistry going forward. So I kind of mentioned a few terms, and if you guys have watched other dental shadowing sessions, you may already know some of this. So I'll kind of breeze through this here, but the numbering system for primary teeth is in letters. So starting in the upper right, it goes from A to J, and then in the lower left, it goes from K to T. The grown-up teeth, it actually goes in terms of numbers. So it starts with 1 with your upper right, goes around to 16, and then going to your lower left, it goes from 17 to 32. Okay. And then our tooth surfaces, we have the incisal, which is the cutting edge of your front teeth, and then the occlusal is the chewing surface of your back teeth. The facial surfaces of your teeth are on the front. So your front teeth is considered labial, and then your back teeth on the facial side, it's called the buccal because it's facing your cheek. On the back side of your tooth, for your front teeth and your back teeth, it's actually the same. It just depends if it's on the top or the bottom. So for your top teeth, the back of it is called the palatal. It's the palatal side of your tooth. And then the bottom is the lingual side because it's next to your tongue. And just some basic tooth anatomy here. So the outer layer of the tooth is the enamel, and then the second tooth layer is the dentin, And then all the nerves and blood vessels, that's considered the pulp in the middle of the tooth. And then the top part where you can see your tooth is the crown, and then the roots are what keeps your tooth and the gums there. Frankl's a really important term in pediatric dentistry. It's our behavior rating scale to see how a child is going to behave during their dental treatment. So this kind of helps us decide, is our child going to need nitrous oxide or laughing gas? Are they going to need to be completely asleep in order to do dental treatment? And then if they're going to be crying, we usually try and see them in the morning. They tend to do better. So there's lots of ways we use a Frankl score. I'll just go over a few of these, but there's also kid-friendly language we use in pediatrics, or what we call euphemisms. So as I think I talked about the nitrous oxide or the silly gas is what makes kids kind of relax while they're getting dental treatment. We don't want to say that, oh, the child's bleeding if they have trauma or something like that. So we could just call it red. Our local anesthetic, we never say the word shot in our office. So we just call it sleepy juice. And instead of saying it's going to hurt, we say it's going to feel really cold, just like Elsa is freezing your tooth. So there's lots of fun ways, and you can kind of get creative with it as well, but that we kind of make it kid friendly when they come to the office to explain everything to them as well. So a little bit about occlusion. So this is when you bite your teeth together, how your teeth kind of fit together. And the way that the baby teeth come together is an important determinant of the position of your grown-up teeth. And so this can kind of help determine, are you going to need braces? Are you going to be okay with your occlusion? So there's usually 4 different ways that we can determine the baby teeth. So the first one is the distal step. So looking at the back molars, it means the bottom molar would go more towards the posterior or the back of the mouth. A flush terminal plane is where the back molars are completely lined up. A mesial step is where the bottom molar edge is a little bit more anterior or towards the front of the mouth. And then there's also an exaggerated version of this. So usually, sometimes the mesial steps can turn into what's called an underbite, where the bottom jaw is more forward. And then the distal step, we would see sometimes what's called an overbite, where the top jaw is a little bit more forward. And it's important to know the occlusion, so when you're doing restorations, you can make sure that nothing is affecting that occlusion, so they can still have good function when they're eating and speaking and everything as well. Okay, so let's jump into our first case here. So my first patient is a 9-year-old male who presented for treatment of recurrent caries in his upper left quadrant. So that means that he got a second cavity on the same tooth, and it was actually on tooth number J. Okay, we always want to make sure we review the medical history in case we need to give any antibiotics or anything like that before, but he was nice and healthy. So our treatment plan to fix this cavity, we are going to give him nitrous oxide, that silly gas that I mentioned, just to keep him nice and relaxed. And we're going to give him a mesial occlusal filling. So if we're going around, that's the upper left back baby molar. We do have an x-ray here. We don't typically take photos, but I did so I could kind of show you guys. So if you're going around on the upper arch, he is 9, so he does have some of his adult teeth. So 7, 8, 9, 10, H, I, and J. So right here in between the tooth towards the midline, so that's the mesial, and then the chewing surface, the occlusal of the tooth, is where we will be doing the filling. So I'll just kind of go over, this is what, sorry, our setup's kind of a bit messy. We just kind of took photos one morning of all of the cases that we were doing. But we do have our dry shield here, which is going to be our form of isolation, our nitrous oxide nose, our numbing medicine, the actual injection. And then we also use a topical agent as well. So we put a little numbing jelly on before we give the injection. So a lot of kids actually don't even realize that we're giving them numbing medicine. So that's a great little trick. And then just our basic setup, we have a mirror so we can see the top tooth, the explorer, some cotton or forceps in case we need to pick up any cotton or anything tiny to put in the mouth. And this is our burr block. So these burrs are what we put into the handpiece, which I'll show you next, to actually prepare the tooth or remove the cavity from the tooth structure. These are the hand pieces that I was mentioning. So we have our air water syringe. This is our high speed hand piece, or what we call Mr. Whistles, because it makes a whistling noise. And then this is Mr. Bumpy, or our slow speed device. So it's a little bit slower, and this one does not blow water out like the high speed does. And then we have our 2 vacuums or suction devices here as well, and another air water for my assistant. And then just here's our setup as well. This is what we call a ball burnisher, so to help put the material into the tooth as well. So not all of these things are needed for the filling, but I will come back to this for my next case. But we do have some floss here, so we can check to make sure that the contact between the teeth is good after we finish the filling. And then these are, for example, this is our steps for a filling is our acid etchant. And then we put the bond on, which is in here because it can be cured by a light. So we have to keep it so that the light in the room doesn't cure it before we end up using it. So we have this special device that will protect it from the ambient light and this little micro brush. And then the last step is we put this composite, which is the white filling material, inside of the cavity area. So kind of during treatment intraoperatively, this is what it would look like when he's on the nitrous oxide. We do have TVs on our ceilings above every patient chair as well. So we put the headphones on for the patient. He just gets to watch a movie while he's on laughing gas, and we have our dry shield isolation in here as well. And this is kind of the nitty gritty. This is what a preparation of the tooth would look like. So we do go in from the occlusal, the top surface of the tooth, to remove the cavity because it's in between the tooth. So this is what a typical preparation may look like. And then when we are placing the composite or the white filling material, we do put this matrix band on. And the matrix band is important so that when we put in the composite material, we don't want to actually glue the teeth together. So this will kind of keep that separate onto the one tooth that we're fixing. And we place a little wedge in between as well, just to make sure there's a really nice contact. So just post-operatively, we can kind of see there's no more cavity there. We have a little filling in there. So the tooth is all fixed. Luckily, he was a Frankl 4, which means that he had really good behavior with the nitrous oxide. So that worked really well for him. And then we do go over post-operative instructions, usually with the parent. Sometimes if they're an older child, we tell them as well. But we do give them gauze to keep in their mouth. A lot of kids will try to bite their lip or scratch themselves because they're not used to being numb and they're not sure what's going on. So they want to make sure that their lip is still there so they can hurt themselves. So that's our biggest little piece of advice we give to parents. Typically after filling, there's no post-operative sensitivity, but if they are a little bit sore, we recommend just some children's Tylenol. Sometimes their bite may feel a little funny for a day or two, but we do check with articulating paper to make sure that their occlusion is pretty much the same as what it was before we did the filling. And then usually after filling, once the numbing medicine wears off, they're pretty much back to normal for diet and oral hygiene for that day as well. Okay, so for our second case, I actually had a 4-year-old female, and she came in for treatment of caries in her lower right quadrant. She's also a healthy girl. So this was kind of the plan that we came up with. So she actually had cavities in between all 8 of her baby molars. So this was the second appointment that we were seeing her for. We can see on the x-ray she had interproximal caries, so right in that flossing area. So last time we did actually the same treatment. So you can see here on the photo, we did one silver crown, the stainless steel, and then a white filling on the tooth behind it because it was a smaller cavity. So today, or for this case, we did the same thing. We planned a pulpotomy and stainless steel crown on this bigger cavity, and then a mesial occlusal composite restoration on the smaller cavity on the tooth behind it. Okay, so a little bit different setup when we're doing a crown. So we need to actually also have our instruments to adjust the stainless steel crown to customize the crown to fit perfectly onto the tooth. And then we also have, we mix our cement in a triturator, and this will express the cement into the crown when it's time to glue the crown on. And then these little cotton pellets have what we call formocresol on them, which is the medicine we put inside of the tooth to kind of, I guess, heal everything before we put the crown on as well. So intraoperatively, this is what it would kind of look like. We go in with our burr and the handpiece to remove the cavity. And then we're also removing the coronal portion of the pulp tissue, so that nerve and blood supply that was infected by the cavity. We put that little cotton pellet with the formocresol for about 5 minutes. And then while we're waiting for that, we're trying on the stainless steel crown to find out what size is going to fit on the tooth. And we're placing a mixture of I or M in there as well once we take out the cotton pellet. So luckily, she was also very good with the nitrous oxide. Sometimes with 4-year-olds, you don't know if they'll be able to do treatment or not, but she was a Frankl 4 with the nitrous oxide, so that worked really well for her a second time. So she should be okay to get the other 2 quadrants fixed in a similar manner. The post-operative instructions are pretty similar to what I went over for just the filling, but we just have them be careful because the glue on the crown, it does take some time to dry, so we want them to avoid any sticky foods. Halloween time, we see lots of kids eating sticky candies and they come in because they pulled their crown off. So we always warn parents about that. And then just because it was a larger cavity, typically that pulpotomy medicine works pretty well, but it's not 100% of the time. So if the child does have any pain on that tooth, we do want the parent to let us know right away. Okay, and for my third case here, this is actually an 8-year-old male patient who was referred from another dentist for treatment of an abscess in the lower left quadrant. And again, he was really healthy, no medical conditions. So the treatment plan was to give him nitrous oxide, and then we were going to remove the infected tooth or do an extraction, and then we're also going to do a space maintainer. So you can see on the x-ray here, this is what our abscess looks like. And I think actually my next slide, here we go. We can see that there is an abscess right here next to that tooth. And it also correlates with the x-ray. So we know which tooth is causing the abscess. And so that's why we came up with the plan for the extraction. Now the space maintainer is a passive appliance that we're going to put in so that the adjacent teeth don't move together, because normally the teeth act as natural space maintainers. We don't want to lose the space for that permanent successor, that permanent tooth that's eventually going to grow in. Oh, there's that last photo. So this shows as well that we were fitting the bands for a lower lingual holding arch on those permanent first molars in the very back. And that's important so the lab knows what size those teeth are. So I'll kind of go over some space maintainers here. So intraoperatively, we did use the nitrous oxide and numbing medicine, the local anesthesia. We removed the tooth. This is what it looked like. So you can see one of the roots is a little bit shorter because it did have that infection and it made the root resorb early from the infection. And then as I showed you, we fit the bands on the permanent first molars. And then this is what we call an impression. So it's kind of a copy of your teeth that we take. We do also have digital impressions at our office, but that's typically used for our Invisalign cases. So we take this impression, pour up a study cast or model, we put the bands on it that we fit, and we send it to the lab to make the fabrication of the lower lingual holding arch. So I'll just kind of go over, we kind of had 3 options since it was the lower arch that we removed the tooth. If there's one tooth being removed, you can use a band and loop device, but because he actually had all permanent incisors in the lower, it's actually recommended to do the bilateral space maintainer. So that's why we chose that one. And then if his permanent first molar had not grown in yet, we would have put what's called a distal shoe, which would have served as a guide for the permanent first molar instead. But luckily, he already had that tooth growing in. So again, he was a Frankl 4. Sometimes kids don't do well with extractions because even if they're numb, they may still feel the pressure from the extraction, but he was a Frankl 4 with the laughing gas, so we were really lucky there. And then post-operative instructions, again, being really careful they're not biting their cheek or their tongue from being numb. I do recommend the Tylenol for extractions because there usually is a little bit of soreness, at least for the first day or so. And then I also like to warn parents, sometimes the top of the blood clot can mix with saliva and it can look like the child's bleeding a lot. But sometimes it's just that little bit of saliva mixing with blood. So we give them lots of extra gauze to take home as needed, but typically the bleeding will stop within a few minutes. So usually the lab takes about 2 to 3 weeks to send the space maintainer back. So we do remind the parent of the importance of coming back so the child doesn't lose that space for the adult tooth. So this is what the lower lingual holding arch would look like when it comes back from the lab. Okay, so I just have some final advice and then we can kind of go into that Q&A session. But I'm really passionate about sustainability. So if everyone incorporates at least one little practice, it can go really big, a long way to reducing our impact in the world. So even if just switching to a bamboo toothbrush, it can really reduce a lot of plastic going into our landfills. As I kind of mentioned, also make sure you take care of your health. In order to take care of the oral health of others, you want to make sure that you're taking care of yourself as well. Okay. Dentistry is a journey and it's a wonderful field because you're always going to be learning. You get to take CE courses every year. There's always new innovations and technology and lots of great things out there. So I think it's great you guys are already taking time out of your busy schedules to do these virtual shadowing sessions and learning. So you're already on the right path. And then also remember to listen to your patient. It's not our job as dentists just to treat the tooth, but you want to take a personalized approach and really treat the whole patient. And in pediatrics, it's really fun because we get to see our patients grow up. And so we get to help them develop those good oral health habits and kind of see how their hobbies and personalities change as they grow up as well. And then also remember, every dentist has a unique path. So it's great. I'm sure if you've listened to a few of these sessions, everyone probably has a different story. So just remember, you're going to have your own unique story. Don't compare yourself to your peers and actually collaborate with one another. A lot of your friends from college and dental school you're going to be referring to one another and learning from one another going forward. So really just work together, and I'm really excited for all of you to hopefully go into the field of dentistry, and just stay connected with your mentors. There's lots of great people in dentistry. It's a small world and we all like to help one another. So yeah, just remember those few things. And I really appreciate you all taking the time to listen to this presentation tonight. This is just my contact information here if you want to reach out to me on Instagram or via email. And I kind of just go over, so like tooth truths and also sustainability practices for not only your life, but also at your dental practice. So hopefully by the time you guys go to dental school, it'll be a little bit bigger part of your education, how you can incorporate sustainability into your dental practice. And this is just a fun little photo from when I was on that Fiji dental mission trip. So yeah, I think that's the end of my presentation.
Dr. Amanda, thank you so much for such an informative session. So it looks like we have about 5 to 10 minutes for a Q&A, if that's okay with you.
Sure.
Awesome.
Okay, so we actually had quite a few questions for you. The first question was, how many dentists have you shadowed, and do you suggest shadowing in high school?
Yeah, so I think in high school, I only shadowed my dentist and my orthodontist, so two different types of dentistry. But then in dental school, I definitely shadowed, I would say, probably close to 10 other different dentists to see different practices. And also some of my faculty invited me to see their practices. So definitely the more that you see, you're going to see different types of dentistry and what you may be interested. So, I mean, I would start with one and then just kind of see what you're interested in and go from there.
Sounds good. The second question was, how do you prepare for the DAT and what resources did you use?
So I think I did the Kaplan preparation and then also studying with some of my classmates. And I also talked to some of my classmates who were ahead of me in the process and had already taken the DAT. So that was really helpful for me as well to kind of see what they learned. Again, it was a little while ago since I've taken it, but so just kind of work together. But I did take the Kaplan prep course for that as well.
Okay. Do you think these dental mission trips might boost your chances of getting the right job?
I think it depends what kind of dentistry you want to go into. I don't think it was a deciding factor. I think towards the end of residency, actually, I did shadow some dentists in the Bay Area that I had reached out to as well. And so I think it's more important that you make a connection with the other people in the practice. But if you're interested in doing mission trips going forward, it might help you if the dentist in that practice also does mission trips.
Mhm. Okay, is this UCS externship open for high schoolers?
So that's typically done in dental school. So you would talk to usually the director of pediatric dentistry to do that. It may be possible to do an internship or something like that at a dental school, not necessarily a residency program, but
Mhm.
you may be able to reach out to them if you wanted to do a tour. That may be something you could do. But all of the externs that we had at our program when I was a resident were already in dental school.
Okay. Do you own your own practice? If not, do you plan to in the future?
Yeah, that's a great question. So right now I'm an associate. So there's one owner of the 3 practices that I work at, and there's a few other associates that work there as well. As of right now, I'm really happy at the practice I'm at. In California, it's definitely, there's a lot of dentists. So it's, I don't know that I would open a practice right now, but I never say never. So maybe.
Right. Okay. How did you apply for the pediatric residency?
Sure. So again, the director of pediatric dentistry helped us a lot, but it's similar to medicine. I don't know if you're familiar with the MATCH program.
Mhm.
You do have to submit a personal statement and letters of recommendation. And then there are some specific, I think it's like maybe 10 questions, it may be more now, that faculty will fill out about you and kind of rank you on certain characteristics. I don't know if it was like a 0 to 5 or 0 to 10 type thing. So you would get those from your faculty in dental school. And then there is an interview process as well. And then once you're done with the interviews, you kind of rank the programs that you're interested in, with one being your top choice, and the programs will rank you as well. And then similar to medicine, there's a match day. So you'll figure out which program you get matched at.
Okay, that makes sense. What summer programs do you recommend taking in undergrad?
So in undergrad, I did, because I did 3 years of undergrad, I actually wanted to take off some of the load of my science classes. So one summer I did organic chemistry. So I squeezed a year of organic chemistry into one summer. So, I mean, I knew I wanted to study abroad at that point, so that kind of helped me do that. So that could be one thing you could do, is just take some of your courses off of your regular schedule and do maybe 1 or 2 during the summer to help lighten your load. And then other than that, I would say the shadowing is a great thing to do during the summer, or even seeing if you can get a job at a dental office. A lot of our assistants or people who help in sterilization are students that are home from college and they're interested in dentistry. So that could be one way you get some hands-on experience in a dental office as well.
Okay, cool. What are some of the most challenging things about being a pediatric dentist, and how do you usually handle those challenges?
Yeah, so like I said, we're always learning in dentistry. And so there's always new technology coming out. So
Mhm.
it was actually good during the pandemic. I had lots of time to take CE courses and catch up on a lot of new things that came out. So that's kind of, I mean, that's fun for me. I don't know, that's a challenge, but that is something you always have to kind of stay on top of in dentistry. And then another thing that's kind of unique to pediatrics is dealing with patients of different ages and different levels of cooperation. And I mean, I kind of see it as, again, it's like a unique challenge that I enjoy working with these kids to learn how I can provide the best dental care for them. Sometimes it's a laughing gas, sometimes it's an extra prize or two. So that's always kind of fun as well. And also in pediatrics, we do use those euphemisms, so explaining it in kid-friendly ways to the patient, and then also helping the parent prepare the patient for the appointment. So those are some unique things that we kind of work with in pediatrics.
Awesome, thank you. I think we're done for today, right, Isa?
Yeah, it is. Unfortunately, yeah, that's all the time we have. Dr. Amanda, thank you so much for coming and giving us such an informative session. It was truly a pleasure to have you today. And I also want to thank our viewers for tuning in to today's session. Please make sure to check out Dr. Amanda's Instagram, which can be found at Bamboo Truth. And in terms of the quiz, that can be found on our Linktree or our GroupMe. And once again, thank you everyone for joining, and I hope you all have a very nice weekend.